Hello, everyone. Thank you so much for joining us tonight. My name is Allie, and I'm the Communications Coordinator with Houston in Action. Houston in Action is an organization dedicated to empowering our community with the support of nonprofit organizations. We work with more than 50 organizations throughout Houston to bring you the best resources for our communities. We are going to start at 7:05 to give time to all who want to join us and need more time. We remind you that tonight we want to hear from you. This space is for us to listen to each other. There is no silly question, and although we want to answer all the questions, we ask that we take this space with respect and do not judge each other. I'm going to continue to wait to give people time to log on. For those of you on Zoom, there's an opportunity for interpretation. You can click and choose to listen in Spanish, Urdu, Chinese, or Vietnamese. Again, thank you everyone for being here with us tonight. As I already said, my name is Allie, and I'm the Communications Coordinator with Houston in Action. Houston in Action is an organization dedicated to empowering the community with the support of nonprofit organizations. We work with more than 50 organizations throughout Houston to bring you the best resources for our communities. As I said, we're going to start at 7:05 to give time for everybody who would like to join in. And tonight really is an Ask Us Anything, and we want to hear from you. So if you're on Facebook, one of our coordinators is on Facebook checking the chat for your questions. And if you're on Zoom, you can put your questions also in the chat. This space is for us to listen to each other. There is no silly question. And although we want to answer all the questions, we'll try and get to them all. What we think is most important is that we treat the space with respect and we do not judge each other. I'm going to take a little pause and we will hand it over to our amazing moderator at 7:05. It is almost 7:05, so I'm going to say my spiel once more. We're going to start at 7:05 to give everybody time to join in. We want to hear from y'all. This space is for us to listen and to come. There is no silly question, and we want to take all the questions we can and do so with respect and without judgment. So it is now 7:04 on my clock, so I'm going to pass it over to our moderator for tonight, the CEO of the Health Museum, John Arcidiacono. Prior to coming to the Health Museum, he served as Vice President of Marketing and Public Relations for the University of Texas MD Anderson Cancer Center. Take it away, John, and thank you so much for being with us tonight.
Great. Thank you, Allie. Thank you for allowing me to participate in this tonight. I'm really excited to be here. It's such an important topic, and I'm thankful for Houston in Action. Okay, I got to go over some ground rules. So let's start with that. One of the very important things to remember tonight is that each of us are people with different backgrounds and experiences. Because of this, we are unable to offer medical advice to you specifically. For official medical advice, of course, you should speak to your doctor because he's the one who knows you better than anybody. We also ask that you do not share your personal information or your medical situation because this event is open to the whole public. Thank you for your understanding and your participation tonight. We know that these are important questions we're going to be discussing tonight, and this topic can be stressful for some people. If at any time you feel uncomfortable, we ask that you take care of yourself and take the necessary steps so that you are well. Houston in Action also reserves the right to expel anyone who chooses not to abide by agreements of kindness and respect. Please, please, please pay attention to that. Anyone removed for not complying with agreements will not be eligible for the incentives we offer later tonight. If there's anyone who does not feel capable of committing to act with kindness and with respect on this call, we ask that you just listen and let others participate. Also, we want you to know that tonight's sessions will be recorded for the use of Houston in Action only. To accept this, please click OK in the window that appears on your screen. Should pop up here in just a minute. Okay, with that, let's get to the important part of the conversation. I am so excited to introduce to you tonight our brilliant medical expert, Dr. Amya Mitchell. Dr. Mitchell is a board-certified pediatrician with over 15 years of experience servicing the Sunnyside and Third Ward community. She graduated from the University of Texas Southwestern Medical School in 2003, and Dr. Mitchell currently serves as the president of the Mary Susan Moore Medical Society, an organization comprised of Black female physicians. Thank you, Dr. Mitchell, for everything you do. Okay, so we want to start out with a couple questions. Now, I know you guys may have some questions. As Ali said, you can put them in the chat, whether you're on Facebook or on Zoom, and then they'll collect them and they'll share them with us later. But let me get things started with a couple questions. But don't forget, we are all in a space where we need to be kind with each other and we need to be respectful with each other. So please take that in consideration. Okay, Dr. Mitchell, my first question is, which children can be vaccinated now?
Well, currently we are vaccinating ages 5 and up. So that means starting at age 5, our youngest ones can now get vaccinated. I guess the 5 to 11-year-olds, that's the new hot topic because that has been recently authorized by the FDA. So right now, the 5 to 11-year-olds are in about their third and a half week of the vaccination process. So some of those age groups have already received both of their doses of the Pfizer vaccine.
Great. Thank you. Thank you. Okay. A question that people are going to ask, and before you answer it, so the question is it safe to vaccinate my child? The regulations, the rules just changed fairly recently, and we all struggle with that. I'll have to give you an anecdotal story. My daughter, who is now 28, she's much older, but 27 years ago, my wife and I were trying to decide, should she get her full vaccinations when they were recommended. We ended up getting her full vaccinations, but we had to think about it a little bit because there were some questions and some concerns that we had. So I understand people may have concerns. I've been vaccinated. I believe in it, and I think it's important for our children. But can you kind of talk a little bit about, especially for those people who wonder, is it safe for my child, how you could kind of answer that question?
Well, one of the things I say a lot is that we have to normalize hesitancy, right? And so I think we have to realize that it's normal to ask questions. It's normal when something is new to maybe want to do more research and dive a little bit more until you get to the point where you feel comfortable. So hopefully this is going to be a space where I can help you get comfortable in making that decision where you decide that this vaccine is safe and this is something that I would like to do for my child or for one of my loved ones. So I guess the short answer is it safe? Yes, it is safe. There are very few reasons why a child should not be vaccinated. And that is usually just if you have an allergy to one of the active ingredients in the vaccine. So if your child has severe allergies where they require EpiPen, now that may be a situation where you want to discuss that with your physician. Other than that, yes, this has been shown to be a safe vaccine based on the studies that we have. And currently about maybe 15% of that 5 to 11-year-old group has been vaccinated.
Okay. And I'm going to reiterate something you said, and this is something that I heard back when they first opened up the vaccines to children. The first thing that everybody said is talk to your doctor. And so it's really important for parents as they're trying to decide what to do to talk to your individual doctor. I think that's really important for you to think about. Okay. So if my child gets vaccinated, or if one of the parents is considering vaccinating their child, we're trying to understand what the side effects may be. And I know they vary, but and I don't know. And then the other question is follow up. Do they vary based on whether you're an adult or a child, or the side effects similar for both?
Well, the side effects can definitely vary. So, for adults and for children as well. So, just as there have been adults who have absolutely no symptoms after receiving the COVID vaccination, for children, it's the same. So, it's a huge range of what you may experience post vaccination. So, the most common side effect that we typically see is just soreness of the arm. So, having a sore arm after the vaccine is probably the most common complaint. And in addition to that, you may have fever, you may have chills, you may have headache, you may feel just tired and fatigued. And those symptoms usually will last like 1 to 3 days, but most people actually experiencing those symptoms within the first 2 days post vaccination. But let's remember that after most vaccines, a lot of people can have side effects. So this is not just because of a COVID vaccine that you can experience side effects. When we even, you talked about starting those vaccines, even in those early years or those early months. So when we start that first set of vaccines at that 2-month-old period, oftentimes you may hear from your pediatrician that after those vaccines, that baby may experience certain symptoms, from fever to not eating as well, to being more lethargic and tired. So having side effects after a vaccine is not just because it's a COVID vaccination. That can actually be seen with any vaccine that we receive, and COVID is no different.
That's so important because I just got my booster about 2 weeks ago, and I had those kind of mild symptoms. Not a big deal. But I remember back when I get my flu shot, sometimes I get the same kind of symptoms with the flu shot. So it's very similar. Okay, we have a kind of a specific question. It was thanks to Crystal on Zoom. She asked this question. My daughter is allergic to milk, eggs, and yeast. Are any of the vaccines safe for her to take?
Are any of the vaccines? I'm guessing since we're doing our COVID talk, we're speaking specifically about COVID vaccines. So there's no contraindications due to milk or egg allergies. But again, for those specific questions, you should always consult with your doctor, with your own pediatrician or your allergist when you have those specific questions. But for my patients who have allergies to those ingredients, there's no reason why they cannot receive the vaccine. Now, personally, what I will do is that for my children who are highly allergic, I just ask for them to have their vaccine in a more controlled environment. So instead of doing a drive-through or the local CVS or parking lot, maybe having it done in a medical facility.
That's great. Yeah, because when I did mine, they made me wait with Harris County Public Health. They made me wait 15 minutes there while they observed me before they let me leave. Is that fairly standard, or with a child like that, would you ask them to stay around a little longer?
Yes, and so standard time is 15 minutes for all children, but for those with a history of allergies, we do ask them to stay for a longer period of time, up to 30 minutes.
Yep, that makes sense. Okay, so we've talked about side effects, and most likely there will be some kind of side effects, even as simple as a sore arm. But if a child has those standard typical side effects, what should a parent do to make sure they're okay, comfortable, and what should a parent do?
Yeah, so just supportive care, right? And so we actually don't recommend in pre-medicating. So meaning that you don't want to give the Tylenol or Motrin or Advil prior to the vaccine. And that's not really just with COVID vaccine. We actually don't recommend pre-medication with any vaccination. There's been some studies showing that it may blunt how well the vaccine works. And so you want to let your body do what it's supposed to do and kind of build up some protection and some immunity towards it. So you don't want to medicate unless you have to. In saying that, you can give Tylenol or Motrin for those mild symptoms, or you can lay down and, let the child take a nap, because that may be one of the times, that they'll typically nap, and maybe they can get a good nap in. So it really just kind of depends on the situation, whether or not you want to do just supportive care, or if you want to treat with some type of antipyretic like, Tylenol or Motrin.
Okay, great. Okay, we have another question from Zoom, and it's from Elena. The question is, hi, why is there more concern with this variant than the other variants that have come out? Okay, so she's asking a question that's important.
Yes.
That we're all talking about as of, what was it, a week ago or something, when Omicron, I think it's how you pronounce it. I think there are two different ways to pronounce it, but when we just started talking about it coming from South Africa. So again, why is there more concern with this variant than the other variants that are out there? So maybe kind of address Omicron for us.
Sure. Well, one thing, well, COVID for by itself is new, right? And so we're learning something as things go on, and we know a lot more about COVID than we did, let's say, a year ago. So anytime there's a new spin or a new variant, it's almost like we're relearning things all over again. So this Omicron variant has multiple mutations. So we're not surprised because viruses do what viruses do, and mutations are quite common among viruses. Now, the thing about this Omicron variant is that it has multiple mutations, and it has multiple mutations specifically in that little spiky piece, that little spike protein. And that's what the vaccine is targeting against. So time will tell, because right now it's really too early to know like how effective vaccines will be against Omicron variant. So many things we're still trying to figure it out. But because it has so many different mutations, it makes us a little bit more nervous in the medical community to see what it's going to do. We saw with the Delta variant what happened, and what happened very fast, because that was the end of the summer, and now it's the predominant strain. So it's the number one type of COVID that we see. So within a few months, it basically just kind of took over. And so that's what can happen when you have variants that are transmitted a little bit easier. And that's what we're saying about this Omicron variant, that it has a higher transmissibility. So meaning that it spreads easier from one person to the next. And saying that, we're kind of all sitting on the fence and waiting to see what it will do. But what we do know is that the more people who are vaccinated, that's a larger area of protection. And so if the virus can't get to you, it can't mutate. So the more people who are vaccinated, the less of these types of mutations that we will see.
And so that's why it's so important to get everybody vaccinated. And that's why it's great that we can now get our children vaccinated as well. So I'm going to reiterate something you said, make sure everybody heard that we still don't know if the current vaccines will take care and protect you from Omicron, correct? We still don't know. They're doing research into that, but we're still trying to figure that out, correct?
Yes. We're still trying to figure it out. I think there's been some preliminary research saying that it looks promising that it shall. Whether or not we may require additional boosters, we don't know. But those of us who are vaccinated, we definitely want to make sure that you're getting your booster in addition, so you can have that extra boost of antibodies to protect you even from these different variants that come out.
Yeah. The one thing I'll kind of mention is that this is all based on science, right? And so science is how we come up with treatments and vaccines and all that. And something I had to remind myself is that science is not perfect, because we're constantly learning. We're constantly getting more information, getting more data. And so that's why it's kind of been frustrating for us consumers, for the general public, because it seems like the information changes, but it's because science is changing and we're learning more, we're getting more information. And so that's kind of, I think, where we are with this new variant. You mentioned, I'm just going to ask the dumb question here because I don't understand, multiple mutations. What is that for a layman? What does multiple mutations mean? It sounds scary, but what does that mean?
Yes, it's the way that the virus, I guess, changes itself to look different, right? And so, we kind of describe it as, one day you may have your hair black, and then the next day you may change it up to red. So when you change your hair to red and you walk into an environment with people where they don't know you as well, you look a little bit different, right? And so the person may not be able to respond and react and say hello as fast as they would have if you had your black hair, right? And so that mutation is just that virus changing just a little bit, just to try to trick our bodies to thinking it's something different, so our antibodies don't work as fast in attacking it.
Okay, so if I walked in with hair, people would go, "Who is that guy?" Right? Okay. Let's see here. Let's see if we have any questions from the folks on Zoom or Facebook. And while we're waiting to see if there are, I'll ask you another one. As we get into the holiday season, now, of course, we just had Thanksgiving, and we've got lots of holidays coming up besides Christmas. We've got lots of holidays. We're in the middle of Hanukkah, I believe. And so a lot of families want to get together. We want to spend time with our relatives, with different generations. What's your advice for families as we think about trying to get together during the holidays that are coming up?
Yes, and that's the beauty of vaccination. So that we can spend more time together. We spent so much time in isolation over the past year. Our grandparents, weren't able to see their grandchildren. We were so isolated for this past year. So I think people are definitely looking forward and we're ready to move forward to having those relationships again. And again, that's why vaccination is definitely important. So it's shown that it's safe to be able to gather when you're around those who have protection. So now that we can even vaccinate our younger elementary school children, 5 and up, that increases that bandwidth of people who you can commune with. And our elderly and those who are 18 and older, and in 6 months post-vaccination, they should be getting their boosters so that we can all commune more and more in safer environments. Of course, when it's possible, you want to do this outdoors, right? Or you want to do masking, if possible as well. But when you're with your small family unit, your bubble, as we say, we are now able to maybe extend that into extended family. Now, I say that with a little bit of, a little angst, just because we don't know what this Omicron variant is about to do. So things can change definitely by the time the holiday season really comes around. And so I would say at the same time, just stay tuned and kind of watch and see, because if things change, we'll see.
Great. Well, that makes me feel better, so that because I'm excited to see family. Okay, the next question is from Anna on Facebook. The question is, can children get the flu and COVID-19 vaccines at the same time? And if so, are the side effects the same? And I'm going to actually tell you really quick, my doctor, and of course, every doctor, consult your doctor, the most important thing. My doctor said to wait a couple of weeks between the two of them. Now, go get my flu shot. I haven't done that yet. But what do you think, Dr. Mitchell?
So initially, we were telling people to wait 2 weeks, and it wasn't just with the flu vaccine; it was with any vaccination. So if you came in for your regular routine childhood vaccinations at the same time where you were going to get your COVID vaccine, we're actually holding whether it was your COVID vaccine for 2 weeks after your childhood vaccines and vice versa. But this actually changed since then. So at this point, you can actually give them at the same time. So you can actually get your COVID vaccine and your flu vaccine together. And as a matter of fact, there are a lot of places. So even if you call the local CVS and you scheduled to get your booster or get your vaccine, they'll ask you if you want to get your flu vaccine at the same time. And yes, it is safe. And it's safe for both adults and children to get them at the same time now.
Well, that's great. That's good to know. Okay. Next from Tanya on Zoom. Hi, with school and holiday gatherings in mind, is there any data that shows how much immunity kids aged 5 to 11 have after the first dose of the vaccine? So a narrow question. So after the first dose, a child between 5 and 11, how much immunity do they typically have?
Yeah, so we don't really advise, just that one dose. And I know people always want to know, well, how much? And the data is kind of, it's kind of a little bit of a range. So from 35 to 60 something percent, that's what you will see after your first dose of the vaccine. That's why it's very important. The reason why it's a range is because there are different variants that work differently against the vaccine. So we really have to make sure that we get both doses, but some protection is better than none. So it shows that you're about 91%, the vaccine is about 91% effective 2 weeks after the second vaccine.
Great. Wow. Dr. Mitchell, you have exact information. I love it. Thank you so much. Okay. Okay. So this is from Amy on Zoom. And it's a little bit long. I'm going to kind of read through this. And I think it's going to be relevant for maybe a couple people out there. But first of all, she thanks us for the opportunity to discuss children's COVID vaccines. She says, my 10-year-old son received his first dose of Pfizer as soon as it was available. 6 days after the first dose, he began showing symptoms. And 8 days later, he tested positive for COVID. Thankfully, his case was mild and has since recovered. Good. Glad about that, Amy. Is it reasonable to wait 1 month after his positive COVID test to get the second vaccine dose?
Okay. Well, first I want to, and I don't think Amy at all is indicating that the vaccine caused COVID, but I just want to clarify that for anybody that may have been confused. So it sounds like her son got his first dose and then developed symptoms consistent with COVID several days later. We do know that the vaccine does not cause COVID infections. So while you may have side effects after the vaccines, it's not because you caught COVID. So what likely happened is that her son was exposed prior to receiving that first dose of the vaccine and then started to experience symptoms after. So I just wanted to make sure that that was nice and clear for anybody that was confused, and I didn't want that to cause any anxiety that the vaccination could at all cause. Can cause COVID. So as far as the timing, like when should you get the second dose after an infection? And after the infection, you can actually get any dose, whether it's a first dose or the second dose, after your quarantine period is complete. All right. So after your quarantine period is complete, it is actually safe at that time to receive a dose of the first or the second vaccine. So, and then you, of course, something this specific, you can always, speak with your physician to get more information, because, he did get an extra boost, from natural immunity at the same time. So I think that it would actually still be okay to wait a little while, but there's no data to say like after you get COVID, after you receive one vaccine, what is that time frame to get one? We know you can get it as soon as your quarantine is over.
Okay, great. Thank you. Okay, the next question is from Ben on Zoom. He says, whenever I talk about vaccinations, I'm asked, quote, what's in the vaccine? So I guess people are wondering what's in the vaccine. So he asks you to elaborate a bit on the factual data. I know I've heard some people say something about a chip in the vaccine, which to me is crazy because you can't put a chip in the vaccine. But what is in the vaccine?
Yes, I mean, there's a lot of theories and discussions about a lot of misinformation about like what is in the vaccine. You can actually get a list of every single ingredient in the vaccine if you go on the Pfizer, the Moderna, the Johnson & Johnson on their website. You can get a full list. When you actually sign up to get the vaccine, which may be too late for some, you may want to know beforehand, they actually give you a list as well that lists all of the different ingredients that is in the vaccine. So for those who do want to know those individual inactive ingredients other than the mRNA and the lipid capsule, you can actually find that.
Okay, let's see here. From Judson on Facebook, is it recommended to give a child a Moderna booster following a vaccination, or is it just as safe to have the Pfizer booster? Yeah, so the big question about switching from Pfizer to Moderna, and then also maybe we talk about J&J as well.
Sure. Now, when it pertains to children, right now we're not actually boostering children. So at this moment, there is no recommendation for those younger than 18 to receive a booster vaccine. And then remember, only Pfizer is approved for those for age 5 to age 16. So it's only for the pediatric indication, it's only Pfizer. So we don't really talk about mixing vaccines in the pediatric population. Now for adults, they have shown now that you can now switch from one vaccine to another. So if you have Moderna, you can get a Pfizer booster. And if you have Johnson, you can definitely also get an mRNA version of the vaccine as well as a booster.
Okay, let's see here. Okay, well, the next question we just answered, actually. So, Allie, do we have another question? The question that just came up was about different manufacturers, and so we kind of addressed that. And since the efficacy rate varies, then we really can't address that either. Okay, so it's from Joshua on Zoom. Are the doses different for children than for adults? For example, the different amounts or the cc's that are given?
Yeah, so the dosage is different for the 5 to 11-year-old group. The 12 and up receive the same exact dose as adults do. So that's 30 micrograms of the mRNA of Pfizer. We only speak in Pfizer terms because that's the only one that's approved for children at this moment, because there are Moderna trials going on, and hopefully Moderna will also be coming out with a pediatric vaccine soon. So it is 30 for adults and then only 10 micrograms for children. So that means that kids to ages 5 to 11 are receiving 1/3 of the dose that adults receive. So it's like chopping an adult vaccine into 3 parts and only getting one piece of that, right? And so they're getting a lot smaller dose, which means that they're actually seeing less side effects because of the smaller dose. And the reason being is that when they first did the studies, they actually did studies on the 30 micrograms, so giving the 5 to 11-year-old kiddos the same dose that adults received. And then they said, okay, well, they were having more side effects. Let's go drop down to 20. And they said, oh, well, they're still having some side effects. Let's drop it all the way down to 10 and then see if they still get the same level of antibody response. And it shows that even way down at 10, they get the same level of antibody response as those like in their mid 20s. So the younger people usually have a more robust immune system. So when you compare it to the younger adults, the 30 micrograms to the 5 to 11 with the 10 micrograms, there's pretty much the same. And I always get the question, well, what if I have a big 10-year-old? What if my 10-year-old is the size of a 14-year-old? You know, what do I do then? Should I wait till he's 14 to do the shot? No, right? And so you want to go ahead and just get the vaccine as soon as possible. The vaccines are not weight-based, so we're all about building up an immune response. So it doesn't really matter. A lot of our other vaccines are received, whether it's flu, are the same dosages for kids and adults. So this one, you don't really have to wait or feel like if your child is much bigger, do they need a bigger dose? And the opposite. So, well, my 12-year-old is kind of a small 12-year-old. Should they get the smaller dose? No. So we do just do it based on the age indication.
That's great. And just knowing that it's a third of what the adults get would make me feel better for my children if I had young children. Okay, the next is from Anonymous on Zoom. Does the vaccine prevent you from getting COVID?
No. Okay. Long story short is no. So, I mean, everybody has heard now that someone who's been vaccinated still can catch COVID. So when I threw that 91% out there, that means there's going to be, a good 9% of people who are vaccinated who still get COVID. So nothing's 100% in science, right? Nothing's 100. We wish, right? From the flu vaccine to so many others, nothing is 100%. So we'll have what we call those breakthrough cases, meaning that even though you're vaccinated, you can still get COVID. Now, sometimes people use that as an argument. Well, why should I get vaccinated if I can still get COVID anyway? So what the vaccine is doing is that it's protecting us, not necessarily from a COVID infection, but from a serious COVID infection that can cause hospitalization or death. Right. And so that is what the vaccines do. They're protecting hospitalizations and death. So when we look at those who are hospitalized and who the deaths that we have, like 99% of those are among the unvaccinated population. So we know that the vaccine is doing what it's supposed to do as far as preventing deaths, preventing the burden that we have on the medical system from so many people being hospitalized. And that is what the vaccine is doing.
Yeah, I think that's so important for people to remember, is that it doesn't stop you from getting it, but it typically keeps you from getting really, really sick. And the data shows that with all the hospitals. Okay, here's a question from Ben on Zoom. Whenever a new expected variant arrives, what happened to the old ones, like the recent Mu variant? And that's actually a good question. Or the Delta variant that we just had. What happened to those?
Yeah, the strongest survives. So whichever one, is basically like the battle of the strongest one. So they basically just kind of die out or become more dormant, we should say, because they may not ever completely resolve, but they typically become more dormant because if you have a higher transmission rate, that means that one's spreading. So that's the one that's spreading the fastest, going from person to person. And so it becomes the new dominant strain. So it's the one that just kind of takes over. So it's not necessarily that they go all the way away, but they're just more rare cases. And we'll see that every year when we see the flu outbreak. There's usually one main strain of the flu that would take over a little bit more than other strains.
Okay. Yeah, that's important. Okay. Next question is from Kathy on Facebook. Is it safe for pregnant women to get vaccinated?
Yes. And so the American College of Obstetrics and Gynecology put this out some time ago, showing that, yes, it is safe for pregnant women to get vaccinated. There's also some preliminary studies, since I'm a pediatrician, showing that you can actually, some of those newborns actually can have some antibodies from maternal transmission. So not only are you protecting yourself, but you may actually be protecting your unborn baby as well by getting vaccinated. vaccinated. Now, of course, like everything else we've said, check with your doctor, right? Your own specific situation. So check with your doctor. And as a generalization, it is safe to receive the COVID vaccination during pregnancy.
Okay, great. And so let's see here. We got another question, but keep the questions coming on Facebook and Zoom. We're so glad you're with us tonight. This is put on by Houston in Action. Thank you, Houston in Action. We got Dr. Mitchell on here. Okay, so next question is from Moses on Facebook. Are boosters safe for children with asthma?
So we kind of spoke on it a little bit before, but right now in children ages 18 and under, there's not a recommendation yet for boosters. And that's not to say that it won't come in the future, because again, we're still figuring all of this out little bit by little bit. And so what's likely going to happen is to see with these new variants, will they require a booster? Remember, those that from 12 and up, they just received vaccinations in about July. So they're just, roughly just now about to hit their 6-month mark right now. So there's no indication really for children to receive a booster. Now, there is a difference between a booster and a third dose. So for those children who are immunocompromised, who have like a low immune system, or who are going through like chemotherapy treatments, or have some type of, immunodeficiency type of diseases, we do recommend, just like in adults, for them to not receive what we call a booster, but for a third dose. And that's basically because you don't have a great immune system, your body can't build enough antibodies to be able to fight off COVID. So we give you an extra dose to be able to allow you to have antibody levels like the general population. And so that dose is actually given 28 days, not the 6-month mark out.
So what you talked about immunocompromised children. Give us an idea of how you would classify immunocompromised children typically.
So, like I said, patients, so like if you're HIV positive, if you're undergoing cancer or chemotherapy type treatments, if you have even severe uncontrolled diabetes, that can even compromise your immune system as well. So for those, in those cases, if you have something called neutropenia, which means that you have a very low white blood cell count where you can't fight off infection. And typically these children know that they're immunocompromised. So it's not that you're going to have a child and you're wondering like, oh, I wonder if, my child should get a third dose. Those parents who have immunocompromised children typically know that they are immunocompromised and hopefully are having these discussions with their physician.
Okay, great. Okay, our next question is from Zoom with no name. The question is it safe to get the Pfizer or a booster if you got the J&J almost a year ago? I'm assuming that must be for adults versus children, since we just allowed children to get them.
Yes. And so for adults, yes, you can definitely do the mix and match vaccine thing now. So meaning if you had the Johnson & Johnson, you can definitely get a Pfizer or Moderna mRNA type of booster, even if it's been a year ago. So anything that's been 6 months out, we actually do recommend you receive a booster.
Okay, great. Okay, the next question is from Anna on Facebook. What recommendations does Dr. Mitchell have for parents whose children may not have insurance or general access to medical care or expertise and are feeling hesitant about the vaccinations? So may not have insurance or general access to medical care.
Yes. Well, even so, remember that there's no cost to receiving the COVID vaccination. So cost is not prohibitive. So even if you don't have insurance, even if you don't have the means to be able to pay for something, you can still receive a COVID vaccination for yourself or your children without the ability to pay for it. So this is one thing where you don't have to worry about money. So if even without medical insurance, you can still receive a COVID vaccination. And there's several clinics around the Houston area that you can still be seen without insurance. So Harris County system, and then there's also some different offices within Texas Children's as well that actually the community cares practices in which you can still be seen without insurance and without the ability to pay.
Yeah, and I'll put a plug in for this. Again, I run the Health Museum, which is over in the Museum District near Herman Park. And every Thursday, we have the Harris County Public Health in there giving out free vaccinations for children as well. My son, although he's 35, he actually came today and got a booster. So if you're interested, the Health Museum, we're on Herman Drive. On Thursdays, Harris County Public Health is there. Okay, next question is from Joshua on Zoom. Is the children's needle length shorter than the adult needles? Because they're always scared of needles. All kids are scared of needles. Well, a lot of adults are scared of needles too, but is the needle the same?
It's not the same. So it's actually, yes, it actually is smaller. And that's something we actually sometimes tell the kids, it's a small one, but really this time it really is smaller. So the needle is actually smaller for children. So that is a great point. Joshua, thanks for that question. So the needle is smaller for the pediatric dose.
That's great. So
the 5 to 11, I must say.
Okay, that's good. And that would make me feel better as a parent. So that plus the fact we're only getting 10 milligrams and, compared to the 30, a third, that makes me feel better as well. Okay, let's see here. Do we have any more questions from Facebook or Zoom? Come on, people. Here we go. Crystal. All right. Crystal on Zoom asks, should someone who has had COVID recently get a vaccine?
Yes, and so even with having natural immunity from COVID, it is still recommended for a vaccination against COVID as well. So you do receive some natural immunity after an infection, but it doesn't last very long. And we don't know how well it works against these different variants. Remember, these different mutations. So whatever type of COVID that you had may not give you enough immunity to the different type of COVID that you may be exposed to later down the line. So with the vaccine, it gives you that extra boost of immunity to give you better protection. And I said earlier on, as far as the time frame, so you can get that extra dose of the vaccine as soon as your quarantine is over. Your quarantine period is over.
Good, great. Okay, from Britt on Zoom. Should parents be worried about our children that are younger than 5 not being able to get vaccinated right now? It's a good question. What about those kids younger than 5?
It is. I would say just be patient. So those studies have been going on from 6 months on up. So as young as 6 months, they're currently doing active studies. The earlier projection was that maybe we'll have some information come January. So, that is not, of course, it's not in my hands. That's definitely, on a much higher level than me. So we're just kind of waiting back and we're waiting to see, what gets approved, what the studies show. We want to make sure that, due diligence is done to make sure that it's safe, especially in that even younger population. So we're going to patiently wait and make sure, though the studies at the 6 month and up have been going on for months as well. So, it's not something that has been done quickly or something that just started after the 5 to 11-year-old. These have been ongoing studies. And as soon as that there's enough data to be gathered to show that it's safe, I'm sure they're going to send it off to the FDA to see if they can get that, authorized as well.
So let me ask you a question, follow up kind of that. The studies that are going on, is it like 5 people that they give the shot to and then they see how they react to it? And you may not know the exact numbers, but tell us a little bit about the studies, because you keep hearing about the studies. Tell us a little about how they do them and how they monitor people and all that.
Sure. So we have some information about the 5 to 11-year-old study. And so there's a little over about 5,000 people, and about 3,000 of those received an active vaccine. The rest of them received the placebo, which means, they just got saline, some water, to see if we can compare those two groups. So it's a pretty decent sample size when you think about pediatric people have to actually volunteer to put their children into studies for a vaccine. So for some people, that's hard to do. Now, I would say that I had several patients who were involved in the studies, and those kids were extremely excited to say that they were one of the first. Most of them were kiddos of healthcare providers and physicians, I would say, because we see kind of firsthand what COVID has done, and they were just ready to get their children vaccinated as soon as possible, even if it meant being a part of a study and making a huge contribution to science. So the studies are fairly large for a pediatric group. And I think initially when it went to get authorized, the FDA said, "Oh, get us a few more to make sure." So they had to kind of go back to the drawing board because it was delayed by a few weeks because of that.
That's great. Yeah, it's good to know. That is a lot of people, 5,000. Okay, from Jimmy on Facebook, can you explain what the difference is between COVID Delta variant and Omicron variant? So what's the difference between Delta and Omicron?
Yes, and so it's really just based on those mutations. I think about the Omicron variant. I think it has about 30 different mutations. So it has quite a few different changes in that little spike protein. So the spike protein, we've all seen that picture of Covet, the big red ball, and has all those little spiky things that look like suction cups kind of coming out of it. Those little spike proteins, the little suction cups that are coming out of it, that's where those mutations are. That's what allows COVID to kind of stick onto our cells and make us sick. So the changes have been mostly in those little spike proteins. And before, maybe a few mutations, so a few changes. But this Omicron, I don't know, it's kind of throwing us a little curveball with that many different mutations. So we just have to see, we're just kind of waiting to see, what does that mean? Does that make it bigger and badder? Or, we don't really know. We're just kind of waiting to see, what does the mutation mean? We don't know yet.
Yep. Okay, thank you. Okay, next question from Joshua on Zoom. Are children able to take the new Merck or Janssen COVID-19 antiviral pills?
So that hasn't been FDA approved as of yet. So we're waiting to see. Now, what children can receive are the monoclonal antibodies for those 12 and up. And so for those high-risk patients, they can receive the monoclonal antibodies if they have an active exposure, or if they either within the first several days of a COVID infection, by speaking with your physician. And those who are kiddos who we would consider to be high risk. And high risk can mean obesity even. So obesity, having elevated blood pressure, or diabetes, or sickle cell, or any other of those chronic illnesses that you may see in pediatrics. I think that's one thing that may be a little bit underutilized, especially in the pediatric community, because children typically fare well, but we still know that there's several who don't. So there's still been like over 8,000 children who have been hospitalized thus far due to COVID. So while most children fare pretty well with COVID, there's still a good amount, who don't.
So you said that they could get, and I'm trying to see if I pronounce it right, monoclonal antibodies?
Monoclonal, yes.
Okay, so what is that, like a shot or something? What is that?
It's actually an infusion. So that would be something you would talk specifically to your physician, because that's something that you actually have to go into a facility, and it's a day procedure. So it's not something you have to spend the night in the hospital for, or anything like that. And it's approved 12 and up. So meaning, you mostly see in adults. It's what President Trump had when he went away. So that was, he had the Regeneron, so the monoclonal antibodies is the generic name for it.
Okay, interesting. We're not getting political on this call.
Not at all.
No, I know. Okay, so next question is from Try on Facebook. Will my child have to take off days from school if they have side effects?
Well, I guess it depends on how severe those side effects are. Most, I said, have very mild symptoms. And I think that, so my child, I can be transparent. So my daughter is 10. And so she received her first dose, and she didn't have any side effects at all. I was prepared because she's, I call her my little drama queen. So I figured if anybody was going to have side effects, it was going to be her. But she thankfully didn't have any on that first dose. But on her second dose, she did have chills, and she was a little tired. We did receive ours on a Saturday, so her symptoms were experienced on a Sunday. But what I've told my friends and colleagues and patients, that just notify the teacher, like, hey, they got their second dose, keep an eye out for them. There's no reason to necessarily keep them out of school, but just making sure that there's communication going on with the school, so if they're not performing at their best, the teacher understands why.
Yeah. Oh, that's good. That's helpful. Okay. The next question is from Benjamin on Zoom. And actually, I think you've answered the question before, but it's probably good to answer it again. So from Benjamin on Zoom, for children that are between 5 and 11, is it good to get the vaccine now or wait for more research?
It would be nice if we could wait, but we don't have that luxury of waiting. So every day that we wait is a potential day of, of another infection. And so we're seeing that kids now represent about 25% of the COVID cases. That's more than kids represent in the entire, the pediatric population. They're only about 22%, but yet they make up 25% of the current infections. So we don't really have the luxury of being able to sit back and wait, because that's every day, that's a potential risk, that a child can have in being infected with COVID. So no, I would not say wait for more research. What the information that we know today is that the vaccine is safe, it has minimal side effects, and it prevents against those terrible complications that we can see with COVID, from long COVID, the long hauler. So those people who have like long-term problems post-COVID. So 6 months later, still experiencing headaches and fatigue and loss of taste and loss of smell. And I always say, COVID is so unpredictable. It's like, rolling the dice. You don't know who's going to be asymptomatic with no symptoms and who is going to end up in the hospital, who's going to develop that MISC that sometimes we see in children, which is that multi-system inflammatory disease where there's multiple organs that are inflamed due to COVID. We don't know who's going to receive, who's going to get what type of complication. So no, I would not wait, so vaccination has been shown to be safe and has been shown to be effective. And it's that extra layer of protection. And that's what we all want to do as parents. We want to give them that extra layer of protection. So they're still going to wear their mask, in those situations. But we have that extra layer of protection now that they're being able to be vaccinated as well.
Great. Thank you. Thank you, Dr. Mitchell. Okay. So a question from Zoom. Does natural immunity help fight colds and flu as well?
And I don't know exactly what that.
I didn't really know either, so I figured you're the smart one. You'll figure out what it means.
Okay. Well, I'll just go. So I'll tackle it from two different ways. So natural immunity, as far as your natural body's immune system, as far as developing antibodies in the past, can help you fight off infections that you've seen before. So if you've had, certain types of colds or certain types of viruses, your body can fight it off a little bit better. So that's why children typically are sicker more often than adults, because we have developed an immune tolerance to different viruses. Now, as far as natural immunity towards COVID, it's not going to help you fight off any traditional colds or flus, because they're different viruses. And I tell people this all the time, because sometimes you get a flu shot and then you're upset that you got sick with a cold. Well, the flu shot only protects you or helps to protect you against influenza, but you can still get sick from a regular cold that's caused by so many different other viruses. So these vaccines aren't like super deals where they're going to protect you against everything. Right. And so sometimes, we kind of think that this is one big blank slate, that because I got a COVID shot, I shouldn't get sick from anything, or because I got a flu shot, I shouldn't get sick from anything. So it's not going to protect against everything.
But it does protect you against a very serious virus that has really impacted the world and killed hundreds of thousands of people. So it is important to get it. Okay, next from Zoom, what are the outcomes for breakthrough cases? Should you continue to quarantine to prevent hospitalization and death? And how many times can one get a breakthrough case of COVID?
Yes. And so as far as the outcomes for breakthrough cases, so we discussed before that, yes, you can still get COVID despite being vaccinated. But what we do see is that your symptoms are typically milder. They're not as severe. So you don't typically have hospitalization or even death rates that we see like among the unvaccinated population. So yes, you should still quarantine. The same, the CDC still advises you to quarantine, because you can still be able to transmit that virus to others. So even though you may not have a severe case because you're vaccinated, you can still transmit your COVID infection to others. And to those who are unvaccinated, they can have a more severe outcome than you would. And what was the second? It was another part to that question.
Let's see here. How many times can one get a breakthrough case of COVID?
So we don't know, yeah. As as we continue to live in the world of COVID, as I would say, I guess we'll find out. I have definitely personally encountered patients who have had COVID on more than one occasion. These are not vaccinated, so you can get COVID, and then several months later, you can catch COVID again. So I've had one as close as 2 months apart with a negative, several never tests in between. So typically, your natural immunity is supposed to last, they say, for a good 3 months, but we don't really know with these new variants if that is truly accurate anymore.
Okay. Here's another question, and it's a good one from Victoria on Facebook. Who is allowed to take kids to get vaccinated? Can teens or young adults take their younger siblings, or does it have to be the parents to take the kids?
So it has to be a parent or guardian.
Okay.
So someone who has legal custody of the child, that is who can bring the child to get vaccinated.
Okay, that makes sense. Okay, the next one is really, really sad question, but how many children have died in Texas or in Houston from COVID? Do you know?
Oh, I don't actually know the specific question, the specific answer, like for our state numbers. What I do know is that that COVID is now the number 8 cause of death among kids. So now is the 8th leading cause of death among children. So when we look at other things that we vaccinate against, so meningitis, chickenpox, hepatitis, flu, COVID has surpassed all of those in the amount of deaths that we see. And so we have vaccinated our children against some of these other pediatric or childhood illnesses, but know that COVID in this short period of time, that we have known COVID, has killed more children than those vaccines that we typically are when we think about vaccine preventable diseases.
Wow, it's such a hard time for parents right now. It's for a hard time for all of us. But especially for parents to make these hard decisions, because you want to protect your child and your children, and you want to make sure you're doing the right thing for them. And so I'm so glad we have this opportunity that Houston in Action put on, and so wonderful that Dr. Mitchell is here answering these questions for us, so those parents can make informed decisions. Again, though, remember to ask your doctor. Talk to your doctor about this. Okay, next question from Zoom. How many unvaccinated people died from COVID in comparison to the deaths of those that were vaccinated? And I think you already said it before. It was like 99%, something like that.
Yes, it was actually like 99.75% percent of those deaths have been among the unvaccinated population. It's important to note that, in order for something to be newsworthy, it has to be different. So oftentimes we'll hear stories on the news about the vaccinated person who died, because that is actually newsworthy, because that doesn't happen often. And so we must remember sometimes, that's the story that kind of takes off, the person that was vaccinated and they still succumb to the disease. But what we're not hearing about are all the deaths, the 99.75% of those who are unvaccinated that may have been preventable through vaccination.
Yeah, it's such a tiny percentage, Okay, the last question. This is from Elena on Facebook. Do we see COVID going away? Are we going to have to be vaccinated every year with a booster due to the variants that keep getting mutated? Good question.
Well, I wish I had the crystal ball to say, because I would wish it to go away. Okay, I would say I wish it would be gone forever. I think the answer is we really just don't know. We don't know whether or not COVID is here to stay like the flu. I think time will tell. I don't think it's going away in any immediate future. So that's why it's important to vaccinate. One way to help it to go away is through vaccination. So what we have seen in other diseases, when we have mass vaccinations, the viruses, that they do go away. So if you think about, for my area, it was the chicken pox. Everybody got the chicken pox. It was kind of like a childhood. You just expected to get it. Now it's been years, since some people have seen chicken pox, if not a decade. So with something as simple as a chicken pox shot, we don't see chicken pox anymore. So the same thing can happen with COVID if we had those mass vaccinations where the pediatric and the adult population alike were both vaccinated against COVID.
Yeah, and the important thing is you think about like polio and other epidemics that have occurred in our history that have been eradicated. Just about polio is only in 2 countries, I believe now, and
Yes.
that's it. And so you can eradicate, you can end a disease like that is debilitating, that really affects people. And we now know, just my personal opinion, we now know so much more about COVID, even though it's changing and we're still learning and we're still doing some research. We know about things we can do to take care of ourselves and protect ourselves and our family. And vaccinations is the primary one. So, okay. With that, I got a couple ending notes here. So let me go through this and we'll see. So first of all, thank you all for being with us tonight. We really appreciate you being here. It's important that you took the time to spend with us. Especially want to thank Dr. Mitchell. She is amazing. Wow, what a brilliant person. What an eloquent person. And she's done a great job of explaining things and simplifying things so that even I can understand. Okay, so if you still have some doubts about vaccines, you can be in contact with Houston in Action via text. So listen to this. You can write it down if you want. Send the word vaccine, VACCINE. So send the word vaccine to 86183. You can send a text to 86183 and type in the word vaccine. So you can find a vaccine event near you at also safertogetherharris.org. So there's a website, safertogetherharris.org. And you can probably just Google Safer Together Harris and it'll come up. Okay, so Houston in Action has other events going on. So if you want to sign up for a future event, go to www.houstoninaction.org. HoustonInAction.org, all one word. Thank you again to Dr. Mitchell for sharing your expertise. This video will be posted on our YouTube channel, and we will be emailing the Amazon gift card on Friday when we pull the emails from the Zoom event. And I believe that's all we have. Allie, did I miss anything? And I think she's not even on. So yes, she said perfect. Okay. Thank you all. Everybody have a good evening and happy holidays.